Nursing students, when studying medications for hypertension, make sure you know about the ACE inhibitors. These medications will be tested upon heavily throughout your nursing school journey and on NCLEX NextGen. As mentioned before, when you know how the medication works, it will be easier for you to learn the side effects as well as what to look for as it relates to the side effects. ACE inhibitors, as we all know in Enpril. Well, how do they work? They prevent the ACE enzyme found in the kidneys from converting angiotensin 1 to angiotensin 2, which is a potent vasoconstrictor. So being that we know that these medications prevent the ACE enzyme in the kidneys from converting angiotensin 1 to angiotensin 2, then it makes sense that we probably would want to give these medications to patients with kidney issues because this medication works on the kidneys. And if the kidneys aren't functioning properly, it's not going to be able to do its job. These medications are used first line for treatment of heart failure as well as hypertension. However, it is not used first line in patients that are Black for hypertension because ACE inhibitors really don't do a good job in lowering their blood pressure. But you may still see a Black patient be on an ACE inhibitor, but they're probably not on that ACE inhibitor to lower their blood pressure, but rather to protect their heart and kidneys, especially if they have diabetes. Because ACE inhibitors are renal protective, which makes it the drug of choice for those who have diabetes and high blood pressure. It is also cardioprotective. So, what are the side effects you should teach your patients to be aware of? First, thinking safety and ABCs, you should teach them to report any signs of angioedema. Thinking about swelling in the face, such as swollen lips, swollen eyes, and swollen throat. This is an anaphylactic reaction and requires immediate treatment, guys. You should also warn them of signs of hyperkalemia. Teach them to report any signs of heart complaints such as palpitations or feeling like their heart is racing. While they're on ACE inhibitors, you want to teach them to avoid foods that are high in potassium such as bananas, orange juice, potatoes, salt substitutes such as Mishra's Dash, as well as other medications that may increase their potassium levels such as potassium-sparing diuretics like spironolactone. A really common but not dangerous side effect your patient may experience is a dry cough, which is harmless. But you should tell them if the cough normally subsides within a few weeks, but to notify the provider if it persists. But if the cough is too bothersome, the provider may switch them to angiotensin receptor blockers such as ARBs because they do not cause a cough. So that sums up this video. See you guys in the next video as we talk more about cardiovascular medications.